Thanks, Professor Amal. My talk about subclinical atherosclerotic predictive value of inflammatory markers in beta thalassemia intermediate patients. Thalassemia is an inherited autosomal recessive blood disorder in which abnormal hemoglobin is produced, and beta thalassemia is the most common type. Endothelial dysfunction that occurs in beta thalassemia patients attributed to peroxidative tissue injury because of continuous blood transfusion, and transfusion-related iron overload in beta thalassemia major has been associated with the onset of cardiovascular complications. Carotid atherosclerosis has been positively associated with serum ferritin independent of other traditional cardiovascular risk factors, and in patients with thalassemia, high incidence of thromboembolic events has been found. Early detection of cardiovascular risk and subclinical atherosclerosis and should represent a priority along with detection of new cardiovascular active substance. Carotid intermediate thickness is used in assessing the presence and progression of atherosclerotic process for its value as an approved marker of early atherosclerosis and has been used in clinical trials frequently for its quantitative value and its trustable results in detecting subclinical atherosclerosis in the clinical settings. It has been found increased in both patients with beta thalassemia major and beta thalassemia intermedia. And there is a growing evidence about the contribution of inflammation to the pathophysiologic features of atherosclerosis, as well as the high sensitive C-reactive protein and interleukin-6 as inflammatory biomarkers. Both high sensitive CRP and interleukin-6 levels have showed correlations with endothelial dysfunction, arterial stiffness, and the extent of subclinical atherosclerosis. So circulating neutrophils are recruited to the arterial walls by interleukin-6 secreted by the stimulated macrophage secondary to the oxidized LDL and the iron overload state in the vascular subintima, which in turn promotes the atherosclerosis. Neutrophils also infiltrate the human carotid atherosclerotic plaques and contribute to destabilization and subsequent rupture of these plaques. And beside being an indicator of systemic inflammation, they were considered to be useful biomarker in predicting the risk of cardiac cerebrovascular diseases and associated with adverse cardiovascular effects. It has been a matter of concern in research to assess the atherosclerosis and its predictors in patients with beta thalassemia intermedia due to the improving survival in thalassemia patients, and more studies were needed. The aim of the study, we aimed at comparing carotid intermediate thickness between patients and with beta thalassemia intermedia and healthy control, besides investigating the relationship between carotid intermediate thickness and lipid profile, iron metabolic indices, and inflammatory markers in beta thalassemia intermedia patients. This study, an observational case control study, included 45 beta thalassemia intermedia patients attending the clinical hematology unit at Assyut University Hospital and 34 healthy individuals as control group, and both groups were comparable for age, sex, and body mass index. The patients included aged 18 years and older, and we excluded patients with acute medical conditions, having infection, high CRP, malignancy, non-immune suppressed, or taking non-steroidal anti-inflammatory drugs or steroids. We also exclude diabetic, hypertensive, and obese individuals. All patients for full history taking with spatial on time of diagnosis, rate of blood transfusion, type of iron chelating agent if present, history of splenectomy, any cardiovascular disease, thrombotic events, and thorough physical examination. The lab involved complete blood count, liver function, serum ferritin, lipid profile, interleukin-6, and high sensitive C-reactive protein. The imaging included echocardiography and carotid intermediate thickness measurement using the carotid Doppler. Our results showed regarding the demographic, our patients aged from 18 to 49 years old, 22 males, 23 females, and their age at diagnosis ranged from 12 to 38 years old. 26 patients with a history of transfusion, 11 patients were splenectomized, and 15 patients were on iron chelation. Out of the 15 patients, 11 patients were indiflazerox, while 4 patients were indifriprone. Patients started iron chelation at variable duration from time of diagnosis. 4 patients started on diagnosis, 9 patients within the first 5 years of diagnosis, and the last 2 patients started later on. Patients not in iron chelation were either not indicated based on serum ferritin or newly diagnosed or due to financial issues. And during the study, all patients were evaluated for the need of starting iron chelation, and the recommended dose prescribed with all the precautions. And in the studied group, no history of previous cardiovascular thromboembolic events Regarding the complete blood count, there is a statistical significant increase in the white blood cell count, absolute neutrophilic count, platelets count, and reticulocytic count, and a statistical significant decrease in the hemoglobin in the patient's group compared to the control. Regarding the lipid profile, statistical significant decrease in the cholesterol, HDL cholesterol, LDL cholesterol, and higher triglyceride level in the studied patients compared to the control. Major mechanisms that had been claimed for hypercholesterolemia in thalassemia patients were accelerated erythropoiesis that enhanced the bone marrow to consume cholesterol to be provided for the erythroid progenitor cells, the reduced hepatic secretion and increased catabolism of LDL cholesterol due to increased production of inflammatory cytokines, the increased clearance of cholesterol by macrophages of the spleen and liver. The increased triglyceride levels could be contributed to the reduced extrahepatic lipolytic activity. The studied inflammatory markers, there is a statistical significant increase in the serum ferritin, in the high-sensitive C-reactive protein, and the interleukin-6. The echocardiographic and carotid Doppler finding, statistical significant decrease in the left ventricular systolic ejection fraction, and the statistical significant increase in the pulmonary artery systolic pressure and the carotid intima media thickness in the studied patients. And based on a cutoff point of ferritin of 800 nanogram per milli, the results revealed that carotid intima media thickness, high-sensitive CRB, and the interleukin-6 were significantly higher in patients with serum ferritin of 800 and more than those with serum ferritin less than 800. The figure showing the same results. We studied the correlation of carotid intima media thickness with the markers, and we found a statistical significant positive correlation with absolute neutrophilic count, serum ferritin, high-sensitive CRB, and interleukin-6 in the studied group. And there is a positive correlation were found also between serum ferritin and both high-sensitive CRB and interleukin-6 and between both of them. The figure has the same results. We did a univariate and multivariate analysis. In the univariate analysis, there were significant relations between carotid intima media thickness, high-sensitive CRB, interleukin, and serum ferritin. Significant collinearity has been observed between serum ferritin, high-sensitive CRB, and interleukin-6, so the multivariate analysis has been conducted after exclusion of the collinear variables, and the best multivariate model included the high-sensitive CRB, which is considered as an independent predictor of carotid intima media thickness. And to study the high-sensitive CRB as a diagnostic test in detecting the abnormal carotid intima media thickness, we conducted the ROC curve, and the cutoff value of 60.4 nanogram per milli had a sensitivity of 63.3% and a specificity of 93.3%. Conclusion: beta thalassemia intermedia patients has abnormally higher carotid intima media thickness than control despite the protective lipid profile, and the carotid intima media thickness was higher in patients with serum ferritin of 800 nanogram per milli or more. Inflammatory markers, absolute neutrophilic count, high-sensitive CRB, and interleukin-6 were higher in beta thalassemia intermedia patients than control, and also both high-sensitive CRB and interleukin-6 were higher in patients with serum ferritin of 800 and more. High-sensitive CRB was an independent predictor of abnormal carotid intima media thickness. Beta thalassemia intermedia patients had lower left ventricular systolic ejection fraction and higher pulmonary artery systolic pressure when compared to the healthy individuals. Recommendations of the study: conducting a prospective study to identify cause and effect relationship. Thalassemia patients should be advised to follow lifestyle modification, proper iron chelation, and control of other risk factors of atherosclerosis for achieving primary prophylaxis of the atherosclerotic events. A randomized clinical trial to clarify the role of anti-inflammatory drugs and statin on the levels of the studied pro-inflammatory markers and the progress of carotid intima media thickness that would provide a more precise vision in the follow-up plan and treatment schedules in those patients. The routine use of Doppler measurement of carotid intima media thickness in beta thalassemia patients as a non-invasive diagnostic method to predict early atherosclerotic changes beside using inflammatory markers as high-sensitive CRB and interleukin-6. The annual echocardiographic assessment to monitor for pulmonary hypertension is recommended for early diagnosis and treatment beside the assessment of left ventricular systolic ejection fraction. This is the paper published with the same title at Expert Review of Hematology on August 2021. Thank you.